Governor Charlie Baker with an update on the state's preparedness for the coronavirus. Good evening and thank you for joining us for Western Mass News at 6. I'm Beth Ward. Chris is off tonight. The governor says Massachusetts remains at a low risk for the virus and it has only had one confirmed case to date so far. That patient has recovered. Governor Baker says that the Department of Public Health has set up strategic steps to respond to the coronavirus and to help the public stay safe.
The Department of Public Health has launched a state website where the latest information and facts on coronavirus are available, established an incident command structure to serve as an organizational system in the event of an outbreak. This will help with information sharing, decision making, and response efforts statewide. Implemented procedures for voluntary home self-quarantine for individuals returning from travel to China. Remain engaged with local boards of health, schools, emergency management service providers, and hospitals to provide the latest guidance and offer state support.
For more on that state support and all of the resources provided from Governor Baker's talk today, you can go to westernmassnews.com. Well, local hospitals are under the gun preparing their staff for the threat of coronavirus. Western Mass News reporter Audrey Russo joins us now live from Bay State Medical Center with the latest on how Massachusetts nurses, doctors, and hospitals are establishing their front line of treatment. Audrey?
Nurses, of course, are often the first healthcare workers to see patients face to face and give them treatment. Local hospitals and the State Nurses Association are reminding workers about the proper protocol for putting on and taking off that protective gear. But several local nurses that I spoke with wonder if that's going to be enough.
There will be transmission in the community. It's just a matter of when that will happen.
Armando Paez is the chief of infectious diseases with Bay State Medical Center. He says although there's only been one confirmed case of coronavirus in Massachusetts, Bay State doctors and workers are constantly meeting about the virus.
There have been several meetings and preparations with infection control and as well as medical health leaders.
Whether it's the seasonal flu, whether it's the behavioral health crisis, whether it's coronavirus, we need enough nurses to take care of the patients.
In Hampshire County, nurses represented by the Massachusetts Nurses Association tell Western Mass News they have concerns about their staffing numbers. They say coronavirus threats loom ominously over MNA negotiations to lower the nurse-to-patient ratio in what's already considered a busy flu season.
It is overflowing on a daily, hourly basis. I mean, we've got nurses that have had 7, 10. We even had a nurse recently that had 13 patients to take care of at the same time.
We reached out to Cooley Dickinson officials. They say they're coordinating their coronavirus preparedness with Massachusetts General and that they have the ability to increase the number of isolation units if needed. Officials went on to say, quote, if there were a surge in patients, we would reallocate medical personnel to ensure all patients were cared for.
We don't know enough about the virus, and the reality of that has come to the forefront.
Meantime, the Health and Safety Associate Director for the MNA says a reduction in scientists and industrial hygienist positions across the medical industry could mean hospitals are underprepared.
Cutting down the knowledge base of what to do. So now in a crisis, we don't have these people who are highly operational.
Christine Pontus tells Western Mass News over the phone she's trained nurses on the Centers for Disease Control's recommended way to put on and dispose of medical protection equipment to avoid contamination. But she says the coronavirus protocol is evolving so rapidly, healthcare workers have to be on at all times. She gave an instance of this during our 20-minute phone call.
From the time that I got on the phone with her, we got 2 emails. That's an example of how fast this is going, about what to do.
Now, at a press briefing earlier today, the governor of Massachusetts and several state health officials said they're going to be updating the state's coronavirus website with the number of how many people are being quarantined for possible fear of having the virus and how many people have been cleared and no longer have any symptoms. Live in Springfield, Audrey Russo, Western Mass News.